but numbers are hard for me to visualize sometimes, so I just want to try this for you. And also work through some of the numbers and some of the issues with how we've been giving these estimates. There are about 242 million adults or Americans 18 years or older. Per the CDC, 35% of those are obese, which by their definition meant that they had a BMI of 30 or greater. Okay? Well, how good is BMI as an indicator of health? Well, CDC itself says you really shouldn't use it, even as an indicator of body fatness or as a diagnostic of body fatness or health of an individual. It's meant for screening purposes. Okay, maybe there's something better. People have looked at something called metabolic syndrome, and per CDC, 34% of adult Americans have metabolic syndrome. Metabolic syndrome is defined as having 3 out of these 5 symptoms: abdominal obesity, elevated serum triglycerides, depressed HDL cholesterol, elevated blood pressure, elevated fasting glucose, blood glucose. Okay? You have 3 out of those 5, you qualify per this authority as having metabolic syndrome. What happens if you only have 2? What happens if you have 1? How accurate are those risk factors at tying to disease? Well, earlier in September, this paper was published in JAMA, and what they reported was 14% of adult Americans are diabetic, 38% of them have prediabetes. That means that 52% of adult Americans are either diabetic or prediabetic. Well, how did they make that diagnosis? Well, diabetes, if you had a diagnosis of diabetes, click, or if you had hemoglobin A1C that was greater than 6.5, or you had fasting blood glucose over 126, or if you, in some cases, they had a 2-hour glucose tolerance test result. You satisfied those, they considered you diabetic. Then there were a series of above normal but below diabetic. That's how they defined prediabetes. And my question again is, how accurate are these? Or are we still looking at some marker that isn't really doing a good job of assessing the disease? Back in the 70s, there was a pathologist who did a number of oral glucose tolerance tests coupled with insulin assays. Now, part of the reason that this policy thing matters is because what he was looking at directly contradicted what the developing policy was going to be. And we can't have that. And so this work has been forgotten until relatively recently, although Joseph Kraft published this in a number of journals. He recently published a book with an intriguing title. Should everyone be tested? Absolutely not. Only those concerned about their future. He's 95 years old. There's recently a YouTube video interview. You can see him. But this is what he found. Of the 14,000 some patients that he administered that coupled test to, 75% of the patients who would have passed based on the results of an oral glucose tolerance test, in other words, this rarely used or lesser used gold standard for diagnosing diabetes, 75% false negative. 75% of the time, your doctor would say, you're fine, you don't have to worry about it. When in fact, what they found was they were hyperinsulinemic to some point. They had some version of elevated insulin. And there's a lot of interesting work looking at insulin levels and their tie to chronic illness. What he found were these characteristic patterns of insulin response as part of this oral glucose tolerance test, where the blue one is a normal line, and then all these 3 represent some kind of elevated or delayed response to insulin. They're seeing this a decade or more before the blood glucose goes wrong. Ophthalmologists are seeing damage to the retina a decade before the blood sugar goes. Specific pathological damage to kidneys before the sugar goes. So again, what are we looking at? How does policy impact what we're actually looking for? And so here we go. Let's go back to this. I showed this where 52% of the population now is either diabetic or pre-diabetic. Let's take that, what would that be? 86% of the population that's not diabetic. Apply that 75% figure to it. And now we're looking at something that looks potentially, I'm making an argument, I'm not saying I got the data to back this up, but I've laid it out for you. We're talking about a huge percentage of the adult population in the United States who is on some spectra of the diabetes, insulin dysregulation phenomenon. Okay? And what we do know is that the right diet is the best prescription for people with diabetes or metabolic syndrome. And this is just one study. Feynman, Volek, and Westman draw your attention to this 50% reduction in insulin, right? We were just talking about hyperinsulinemia. And this diet is one that's restricted in carbohydrates, and the light blue color is the low-fat diet that's recommended to us by our official government policy and public health educators to reduce our incidence of chronic disease. If I'm anywhere close to being right with estimates, nothing else matters. Because we can't know anything else until we've accounted for this. This is the biggest noise in the system. And so anybody who wants to talk to me about the tie between various components and some chronic illness that doesn't account for the fact that we're dealing with at least 50% and perhaps as much as 80% of the adult population being diabetic, pre-diabetic, hyperinsulinemic, sorry, I don't think we have that kind of confidence. So the problem with all this is there's all kinds of belief systems involved and political philosophies involved and agendas involved. But at the end of the day, we're talking about human beings. And you can tell when idols are being worshipped because human beings are being sacrificed. The children of this mother are going to be impacted by their environment in utero. And there's suggestion that, in fact, her children will be impacted by what happened to her in utero. We are facing a huge economic cost from a failing healthcare system that's struggling to deal with the burden of diabetes. Those of us who are in the livestock industry, while we've been blamed for that, ironically, are in a position to provide the product that's the best prescription for people that are in that condition. So is there anything more pitiful than a life lost in the service of some unfound belief? I dream of the day when the public understands that their consumption of the products in the background lessens their need for the products in the foreground,